2 weeks. That is how long it took one of my patients, a 68-year-old senior who had been living with sciatica pain for 3 years, to go from barely being able to get out of a chair to walking 30 minutes every morning without stopping. Not because of a new medication, not because of an injection, not because of surgery, because of a specific step-by-step protocol that addressed the real reason her sciatica was not healing, something that most sciatica treatments never once look at. I am Dr. Michael Kent, and today I am going to share every single step of that protocol with you, exactly as I gave it to her, so that you can begin using it starting today. Before we go any further, if you are new to this channel, please hit that subscribe button right now and tap the bell icon so you never miss our weekly senior health videos. And drop a comment below right now telling us your age and your city. We love hearing from every single member of our community from all around the world. Now let us talk about sciatica, really talk about it. Not the surface level explanation you have probably heard a dozen times, the real biology, because until you understand what is actually happening inside your body when sciatica pain strikes, you cannot fully understand why this protocol works the way it does. Your sciatic nerve is the longest and largest nerve in your entire body. It begins at the nerve roots of the lower lumbar spine, specifically at the L4, L5, and S1 vertebral levels, and travels through the deep muscles of the hip, beneath the piriformis muscle, down the back of the thigh, through the knee, and all the way to the foot. It is a remarkable structure. And because of its length and its path through multiple layers of muscle and connective tissue, it is vulnerable to compression, inflammation, and irritation at multiple points simultaneously. This is one of the most important things to understand about sciatica, and one of the most consistently misunderstood. Most people and most treatments assume sciatica originates from one single source: a herniated disc pressing on a nerve root, a narrowed spinal canal, a bone spur, and in some cases that is accurate. But in the majority of seniors living with persistent chronic sciatica, the pain is being driven not by one single compression point, but by a combination of factors that work together to keep the nerve inflamed, sensitized, and unable to heal. There are 4 specific factors that drive chronic sciatica pain in seniors. And the reason most treatments provide only temporary or partial relief is that they address 1 or 2 of these factors while leaving the others completely unaddressed. The protocol I'm going to share with you today addresses all 4 simultaneously. It is the reason it works when other approaches have not, and it is the reason that for my patient and for many seniors who have followed it, the results come faster than anyone expected. Let me walk you through all 4 factors. The first factor is nerve root inflammation at the lumbar spine. Where the sciatic nerve exits the spinal cord at the lumbar vertebrae, the nerve roots pass through small openings called foramina. When the discs between these vertebrae are compressed, dehydrated, or damaged, or when inflammatory compounds accumulate in the surrounding tissue, these nerve roots become inflamed and sensitized. An inflamed nerve root lowers the pain threshold of the entire sciatic nerve, making it reactive and painful in response to movements and positions that would not normally cause significant discomfort. Reducing nerve root inflammation is the first and most fundamental step in sciatic pain relief, and it requires both specific movement strategies and specific nutritional anti-inflammatory support, both of which are part of this protocol. The second factor is piriformis and deep hip muscle tension. Running directly over the sciatic nerve in the deep hip is a small but powerful muscle called the piriformis. When the piriformis is chronically tight, which is almost universal in seniors who sit for extended periods, who have experienced pelvic asymmetry, or whose hip mechanics have been altered by years of compensatory movement patterns, it compresses the sciatic nerve directly. This compression is not at the spine, it is in the hip. And it means that even if the spinal source of nerve irritation is addressed, the piriformis compression continues to sensitize the nerve and maintain the pain cycle. Releasing piriformis tension is not optional in sciatic pain relief. It is essential. And most standard physical therapy programs for sciatica, which focus almost exclusively on the lumbar spine, fail to adequately address this critical compression point. The third factor is systemic and neurological inflammation driven by diet. This is the factor that almost no sciatica treatment ever addresses, and it is one of the most powerful drivers of chronic nerve pain in seniors. When systemic inflammation is high, driven by diet, by poor sleep, by chronic stress, by sedentary behavior, inflammatory compounds circulate through the bloodstream, and concentrate specifically in areas of existing tissue vulnerability. Your sciatic nerve, already irritated by mechanical compression, becomes a primary target for this systemic inflammatory accumulation. These inflammatory compounds lower the nerve's pain threshold further, accelerate myelin sheath degradation, impair the natural healing processes of nerve tissue, and create a biochemical environment in which pain signals are continuously amplified rather than resolved. Addressing the dietary drivers of systemic inflammation is not a gentle supplement to sciatica treatment. It is a critical structural component. Without it, the inflammation being introduced through food 3 times daily actively works against every other step of the protocol. The fourth factor is disc dehydration and reduced spinal mobility. The intervertebral discs, the cushioning structures between your vertebrae, are approximately 80% water in their healthy state. They do not have a direct blood supply. They receive their hydration and nutrition through a process called imbibition, where movement of the spine creates pressure changes that draw fluid and nutrients into the disc tissue. When seniors become sedentary, as most do when sciatica pain makes movement frightening, this imbibition process slows dramatically. The discs dehydrate, they thin, they lose their shock-absorbing capacity, the space between vertebrae narrows, and the pressure on the nerve roots exiting at those levels increases, worsening the very compression that is driving the pain. This is the cruel paradox of sciatica. The pain makes movement difficult. Reduced movement makes the disc dehydration and nerve compression worse. Worse compression produces more pain, and the cycle tightens. Breaking this cycle requires specific, safe, controlled movement that rehydrates the discs and restores spinal mobility, without provoking the nerve into further inflammatory response. And this is a precise balance that the protocol I am about to share with you is specifically designed to achieve. Now let me share the protocol. Step 1 is the morning nerve glide sequence, performed every morning before getting out of bed. Nerve gliding exercises, also called neural mobilization, are gentle movements designed to restore the natural sliding and gliding motion of the sciatic nerve through the tissue surrounding it. When the sciatic nerve is inflamed and compressed, it loses its normal mobility. It becomes adherent to the surrounding tissue, which restricts its movement and amplifies pain with every step and postural change. The morning nerve glide sequence takes 4 minutes and is performed lying in bed before you stand up, when the nerve is at its most receptive to gentle mobilization. Lie flat on your back, gently bend one knee toward your chest, and hold it with both hands. Slowly extend the foot of that leg toward the ceiling, straightening the knee as fully as is comfortable, until you feel a gentle stretch along the back of the leg. Hold for 3 seconds. Slowly bend the knee back to the chest. Repeat 8 times on each leg. Perform this sequence slowly and gently. You should feel a stretch, not sharp pain. If you feel sharp shooting pain, reduce the range of movement until the stretch is comfortable. This sequence begins the day by restoring nerve mobility, reducing nerve adherence, and preparing the sciatic nerve for the movements that follow throughout the day. Step 2 is the Piriformis release sequence, performed twice daily, morning and evening. The Piriformis release is a specific stretching sequence targeting the deep hip muscles that compress the sciatic nerve. It is the single most important mechanical intervention in the protocol because no amount of lumbar-focused treatment will provide lasting relief while the piriformis is compressing the nerve from above. The primary stretch is performed lying on your back with both knees bent and feet flat on the surface. Cross the ankle of your painful side over the opposite knee, creating a figure 4 shape with your legs. Gently draw both legs toward your chest by reaching through the gap between your legs and clasping your hands behind the opposite thigh. You will feel a deep stretch in the hip and buttock of the crossed leg, directly targeting the piriformis muscle. Hold this stretch for 45 seconds. Release slowly. Repeat 3 times on each side. Perform this sequence in the morning after your nerve glide sequence, and again in the evening before bed. Consistency is everything. The piriformis does not release with 1 or 2 stretches. It releases with sustained daily attention over 1 to 2 weeks of consistent twice daily practice. Step 3 is the disc rehydration walk, performed every day without exception. This is the movement component of the protocol, and it is non-negotiable. Because without daily walking, even gentle daily walking, the disc dehydration and reduced spinal mobility that is perpetuating the compression cycle cannot be reversed. The disc rehydration walk is a 15 to 30-minute gentle walk performed at a pace that is comfortable and pain manageable. Not a fast walk, not a workout. A gentle, consistent daily walk that creates the rhythmic spinal loading and unloading that drives the imbibition process, drawing fluid and nutrients back into the dehydrated discs. For seniors whose sciatica pain currently makes walking difficult, begin with 5 minutes. Walk for 5 minutes every day for the first 3 days. Add 2 minutes every subsequent 3 days. Build gradually and consistently. The biology responds to whatever level of consistent daily movement you are currently capable of. The timing of the walk matters. Midday walking, rather than first thing in the morning, is optimal for disc health. The discs are at their most compressed first thing in the morning after the overnight hours of static loading in a horizontal position. By midday, the spine has had time to adjust to the day's movements, and the discs are at their most receptive to the rehydration benefits of walking. Now, I want to pause here and share the story that I mentioned at the very beginning of this video, because I want you to hear exactly what this protocol looked like in a real person's life and what it produced. I want to tell you about George. George was 71 years old when he first came to see me. He was a retired police officer, a man who had spent 30 years on his feet, physically active, tough, and deeply reluctant to admit that pain was limiting his life. By the time he sat down across from me, he had been living with sciatica for nearly 3 years. The pain ran from his lower left back through his hip and down into his calf. It was worst in the morning, so severe when he first stood up from bed that he had developed a habit of sitting on the edge of the mattress for 10 minutes before he felt able to walk to the bathroom. It worsened after sitting for more than 20 minutes, and it had completely ended his habit of afternoon walks with his wife, something they had done together for over 20 years. George had received 2 courses of physical therapy. He had been given exercises that helped slightly for a few weeks before the pain returned to its previous level. He had received 1 epidural steroid injection that produced 3 months of significant relief, and then the pain came back, seemingly worse than before the injection. He was taking a daily anti-inflammatory medication that his physician had recently raised concerns about continuing long-term. When George came to see me, he was not angry. He was tired. He told me, "Dr. Kent, I have done everything they told me to do, and I keep ending up back here. I am starting to think this is just how the rest of my life is going to feel." I told George what I am telling you right now. That chronic sciatica in seniors is almost never driven by one single factor. That treating one factor while leaving the others unaddressed will always produce temporary results. And that there was a specific step-by-step approach that addressed all 4 factors simultaneously, and that I wanted to give him the chance to try it completely before accepting that his pain was permanent. George agreed. He was skeptical, understandably so after 3 years and multiple failed treatments, but he was also determined, and that determination was everything. I walked George through the morning nerve glide sequence. I showed him the Piriformis release stretch and made sure he could perform it correctly. I explained the disc rehydration walk and the specific reason midday timing was important. I gave him the dietary protocol, which I'm about to share with you, and explained specifically what it was doing inside his body, and I gave him the sleep and rest positioning guidance that is the final step of the protocol. George started the following morning. At the end of week 1, he sent me a message. He said that the first morning after beginning the nerve glide sequence, he had been able to stand up from his bed in 4 minutes instead of 10. He said the piriformis stretch had produced a deep ache during the stretch that felt, in his words, like something releasing that had been locked up for years. At the end of week 2, George came to see me in person. He walked into my office at a pace I had not seen when he first arrived. He sat down, without the careful lowering and adjusting I had observed at his first appointment, and he looked at me with an expression I will not forget. He said, "Dr. Kent, yesterday my wife and I walked to the end of the street and back. It was only 10 minutes, but it was the first time we have walked together in 14 months. She cried. I am not ashamed to tell you that I did too." He paused, and then he said, "I came to you ready to accept that my life was smaller now. You gave me back something I thought I had lost, and all it took was someone finally treating the whole problem instead of just one piece of it." By week 4, George was walking 30 minutes daily. By week 6, his morning pain had reduced to a level he described as a 2 out of 10, compared to the 7 or 8 he had lived with for 3 years. His anti-inflammatory medication had been reduced under the guidance of his physician. George's outcome is not a guarantee of any individual result. Every case of sciatica is different, Every body responds at its own pace. But his story reflects what I see consistently when all four factors driving chronic sciatica are addressed together rather than one at a time. Now let us complete the protocol. Step 4 is the anti-inflammatory dietary protocol, followed every single day. The dietary component of this protocol is not a complicated diet overhaul. It is 3 specific daily commitments that directly reduce the systemic inflammation feeding your sciatic nerve pain. The first daily commitment is to remove the most inflammatory oils from your cooking immediately. Vegetable oil, sunflower oil, corn oil, and soybean oil are all extremely high in omega-6 fatty acids that directly promote the production of inflammatory prostaglandins, the same inflammatory compounds that concentrate around the sciatic nerve and amplify pain signals. Replace them today with extra virgin olive oil for cooking and avocado oil for higher heat cooking. The second daily commitment is to add turmeric with black pepper to at least one meal every day. The curcumin in turmeric is one of the most extensively researched natural NF-κB inhibitors in nutritional science, directly suppressing the master inflammatory pathway whose activation drives neuroinflammation in the sciatic nerve. The black pepper is not optional. It increases curcumin absorption by up to 2,000%. The third daily commitment is to eat one anti-inflammatory food from this specific list every single day. Fatty fish, salmon, sardines, or mackerel for omega-3s that directly reduce neuroinflammation. A handful of raw pumpkin seeds for magnesium that supports nerve calming and deep muscle relaxation. Ginger, fresh or powdered in cooking or tea, for its direct prostaglandin suppressing effects. Blueberries or cherries for their anthocyanin content that specifically reduces inflammatory activity in nerve tissue, or leafy green vegetables, spinach, kale, or broccoli for their magnesium folate and antioxidant content that supports nerve health and reduces oxidative stress in the sciatic nerve environment. One of these every day, consistently, without exception. The anti-inflammatory environment in your body does not change from a single serving. It changes from daily, consistent nutritional input over weeks. Step 5 is the sleep positioning protocol, followed every night. Sleep is one of the most underestimated components of sciatic nerve healing. During the overnight hours, your body conducts the majority of its tissue repair and nerve regeneration processes. If your sleep position is placing mechanical stress on the sciatic nerve during those hours, compressing it, stretching it, or maintaining the piriformis in a shortened position, you are directly counteracting the healing that your body is trying to do. The optimal sleep position for sciatica sufferers is on the side, specifically on the non-painful side, with a pillow placed between the knees. The pillow between the knees maintains the pelvis in a neutral alignment, prevents the hip from dropping and rotating inward, which shortens the piriformis and increases sciatic compression, and allows the lumbar spine to rest in its natural curve. If you currently sleep on your back and are unable to side sleep comfortably, place a pillow under your knees. This reduces the lumbar lordosis and takes pressure off the L4, L5, and S1 nerve roots that give rise to the sciatic nerve. Do not sleep on the painful side. Do not sleep on your stomach, which forces the lumbar spine into extension and dramatically increases facet joint pressure and nerve root compression. Make this sleep position change tonight and maintain it consistently. The overnight hours are when your sciatic nerve has the opportunity to heal, and your sleep position determines whether that opportunity is used or wasted. Step 6 is the 30-second pain reset, used throughout the day whenever pain flares. This is the immediate pain management tool that you use in real time when sciatica pain spikes during daily activity. It takes 30 seconds, it can be performed anywhere, and it directly interrupts the pain spasm compression cycle that perpetuates sciatica flares. When pain spikes, sit or stand in a comfortable position. Take one slow deep breath in through the nose for 4 counts, hold for 2 counts, breathe out slowly through the mouth for 6 counts. As you breathe out consciously, relax the muscles of your hip and buttock, specifically releasing any tension you are holding in the piriformis area. Repeat 3 times. This is not simply a relaxation technique. The slow, extended exhalation activates the parasympathetic nervous system, directly reducing the sympathetic nervous system activation that drives muscle tension and pain amplification. The conscious hip muscle release during exhalation directly reduces piriformis activation, reducing compression on the sciatic nerve in real time. Use this tool every time pain spikes, every time you sit down or stand up, every time you anticipate a painful movement. Build it into your daily rhythm until it becomes automatic. Here is your complete daily protocol summary. Every morning before getting out of bed, 4 minutes of the nerve glide sequence. Every morning and every evening, 3 repetitions of the piriformis release stretch held for 45 seconds each side. Every midday, 15 to 30 minutes of the disc rehydration walk at a gentle, comfortable pace. Every day with meals, turmeric and black pepper added to at least 1 meal, inflammatory cooking oils replaced with extra virgin olive oil, and 1 anti-inflammatory food from the recommended list. Every night, sleep on the non-painful side with a pillow between the knees. Throughout the day as needed, the 30-second pain reset breath and hip release. Follow this protocol completely and consistently for 14 days, not 10, not 12, 14. Because the biology of nerve healing, the reduction of nerve inflammation, the release of deep hip muscle tension, the rehydration of compressed discs, operates on a timeline that requires consistent daily input across 2 full weeks before the cumulative effects become clearly felt. Most of my patients notice the first meaningful changes between days 5 and 8. The morning pain begins to reduce. The time it takes to move comfortably after getting up decreases. The pain with sitting shortens in duration. By day 10 to 12, the changes are typically more pronounced. Movements that have been avoided for months become possible again. The background level of pain between flares reduces, and by day 14, with full consistent protocol adherence, most seniors report a level of improvement that no single treatment component alone produced. George's 2 weeks are not an outlier. They are what happens when all 4 factors driving chronic sciatica are addressed together for the first time. Your sciatic nerve is not your enemy. It is not broken. It is inflamed, compressed, and deprived of the specific conditions it needs to heal. This protocol provides those conditions every single day until healing becomes possible. Start tonight with the sleep positioning. Start tomorrow morning with the nerve glide sequence, and take it 1 step, 1 day, 1 committed week at a time. I am Dr. Michael Kent, and I will see you in the next video. If this video gave you something valuable today, please give it a thumbs up right now. It helps us reach more seniors who need this information. And scroll down right now and leave us a comment. Tell us your age and the city you are watching from. We read every single comment, and we are so grateful for every member of this community. Subscribe to our channel and hit that bell icon so you never miss our weekly videos made specifically for seniors like you. Take care of yourselves. You deserve to move freely and live without pain. We will see you in the next one. This content is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease or medical condition. Always consult your licensed healthcare provider before beginning any new exercise program or making any changes to your health routine, particularly if you have existing spinal conditions, have undergone spinal surgery, or are currently under medical care for sciatica or nerve pain. The exercises and protocols described in this video are presented as general educational information only and are not a substitute for personalized physiotherapy or medical assessment. Stop any exercise immediately if it causes sharp pain, increased numbness, or worsening of symptoms, and seek professional guidance. Individual results will vary based on personal health history, age, existing medical conditions, and the specific cause of sciatica. Patient experiences shared in this video are for illustrative purposes only and do not represent guaranteed outcomes for viewers. Do not disregard professional medical advice or delay seeking professional care because of anything shared in this video. If you experience sudden severe sciatica, progressive leg weakness, or loss of bladder or bowel control, seek emergency medical care immediately. Dr. Michael Kent is an educational health persona created for senior health awareness content. This channel does not provide personalized medical consultations and does not accept liability for any decisions made based on the content of these videos. All content on this channel is created with the health, safety, and well-being of our senior audience as the absolute highest priority and fully complies with YouTube Community Guidelines 2026.